Chemical mediators of the inflammation source. General features of the chemical mediator. General features mean जो चीज़ आएगी वो है एक तो source, tightly regulated reactions, and it is interrelated, and these bind specific receptors on the target cells, and the diverse on target is there, and also short-lived. Generalized feature. उसके बाद जो देखेंगे वो है source. अब सोर्स क्या होता है? सोर्स दो तरह के होते हैं, एक तो सेल डिराइव्ड, एक तो प्लाज्मा डिराइव्ड होता है. सेल डिराइव्ड प्रेजेंट एज द प्री फॉर्म मॉलिक्यूल और may synthesize in the de novo process. ये प्री फॉर्म मॉलिक्यूल भी हो सकता है लाइक द हिस्टामिन इन द मास्ट सेल granules, and also they synthesize in the de novo like the prostaglandin and the cytokine. They produced by the platelet, neutrophil, monocyte, macrophage and the mast cell. PN3M. PN3 मतलब P से हो जाएगा प्लेटलेट, N न्यूट्रोफिल, and 3M मतलब मोनोसाइट, मैक्रोफाज and the mast cell. The plasma derived chemical mediators, they are produced by the liver and present in the circulation as the inactive precursor, require activation like the complement system and kinins. उसके बाद फंक्शन, उसके बाद केमिकल फीचर्स में आ जाएगा. ये केमिकल मेडिएटर स्टाइली रेगुलेटेड एक्शन देता है और ये सब इंटर रिलेटेड होता है लाइक द वन स्टिमुलेट द अदर, एंड जो सेकेंडरी बनता है वो सेम फंक्शन कर सकता है, सिमिलर फंक्शन और अपोजिट फंक्शन भी दे सकता है. द बाइंड स्पेसिफिक रिसेप्टर्स ऑन द टारगेट एंड देयर टारगेट आर डाइवर्स, मेनी टारगेट इज देयर, एंड देयर एक्शन इज शॉर्ट लिव्ड और दे ऑल्सो शॉर्ट लिव्ड. Cell-derived chemical mediators are vasoactive amines like the histamine, serotonin, arachidonic acids, prostaglandin, thromboxane, platelet activating factor, reactive oxygen species, nitric oxide, and the cytokines and chemokines. First chemical mediators is the vasoactive amines. Vasoactive amines with histamine and the serotonin. The most common property of both of these are they are the first released during the inflammation. They store as a preform molecule and the immediate transient response. The response is called the immediate transient response. They are the first released during the inflammation and they store as a free form molecule. Histamine is found in the mast cell, basophil cell and the platelets. Serotonin is found in the platelet, neuron and the endochromphin of the GIT. Histamine is found in the mast cell. Histamine is found in the mast cell, blood, basophil and the platelets, and serotonin is a platelet, neuron and the endochromphin of the GIT. Stimulation for the histamine release are the physical injury like the trauma, cold and the heat, immune reaction like the allergic reactions, or the C complement like the C3A and the C5A, leukocyte derived histamine releasing protein, or the neuropeptide substance P, cytokine like the interleukin 1 and the interleukin. Action is the action of the histamine is the dilatation of the arteriole and also increase the vascular permeability. But for serotonin, the stimuli are the platelet function is the platelet aggregation, and also the antigen platelet aggregation or stimuli is the antigen antibody complex. Next is the platelet activating factor. Their function vascular reaction like the vasodilatation and the increase the vascular permeability. Cellular reaction is increase the WBC adhesion to the endothelium and the chemotaxis. The increased synthesis of the other mediators like the glycosanoids. Their function is the vascular reaction like the vasodilatation and the increase the vascular permeability. Cellular reactions like the increase the WBC adhesion to the endothelium and also chemotaxis, and also the increases the other mediators like the glycosanoids. Next is the reactive reactive oxygen species. In the WBC, like the most of the neutrophil and the macrophage. On exposure to the microbes or the chemokines immune complex, they produce the superoxide radicals which combine with the nitric oxide to form the peroxynitrite, and also they form the H2O2 and the hydroxyl radical. Action of these radical are they have the both pathologic and the physiologic action. Pathologic action and the physiologic action. Physiologic action is the reactive oxygen species in the WBC kill and the phagocytosed microbe and necrotic cells. And the pathologic is the endothelium cell damage, increase the pathologic action. Endothelial cell damage, increase the vascular permeability. Injury to the cell causes the tumor, parenchymal cells under RBC, and the inactivation of the antiprotease like the alpha 1 antitrypsin and causes destruction of the elastic tissue in the emphysema. Pathologic three function is there. एक तो endothelium cell damage to causes the increase in vascular permeability, injury to the other cells like the tumor cells and the parenchymal cell RBC, and inactivation of the antiprotease like the alpha 1 antitrypsin with destruction of the elastic tissue in the emphysema. Physiologic is the ROS which kill the phagocytosis microbe and the necrotic cells.